I would like to welcome you to the first week of our course, Economic Evaluation in Global Health. Week 1 is divided into 3 parts. In the first part, we are going to describe what global health means, or at least the way that I understand it, and look at health systems and health interventions. For some of you, this is going to be like revision, because you might have a good idea of the kinds of health interventions that people undertake. In the second part, we'll look at the definition of economic evaluation, and we will finish this week by discussing the concepts of value in healthcare and how to decide whether an intervention is cost effective relative to another. So let's start out with defining global health and healthcare systems. So I wanted to use this table to discuss the concept of global health. There is no accepted definition of global health. People have a number of definitions going around, but I like this paper that I assigned as a reading for this week that has a table that tries to compare and contrast global health with the more established fields of international health and public health. And there are 5 different attributes. The first one is geographical reach. Global health is transnational in nature. International health is usually bilateral, with one country helping another. And public health involves populations. And these populations can range in size from, the entire globe, or a classroom of individuals who get a disease like the flu. So public health is about populations. With regard to the level of cooperation required to achieve specific health objectives, global health is a field that essentially requires global cooperation. In international health, you usually have binational cooperation. So a rich country like the US might give a country like Ethiopia, which is not so rich, money to perform a certain program, a certain health program. But the agreement is between the US and Ethiopia. For public health, you have local solutions for problems that may occur in the community. With regard to individuals or populations, both global health and international public health touch on prevention and clinical care, whereas public health essentially is about population prevention. And with regard to access to healthcare, global health and public health both emphasize equity. And this is an important point. Equity. But in global health, the equity is among nations and for all people, while in public health, it's equity within a nation or a specific community. But this issue of equity is very important in global health, and some people define global health as the field in which people tackle problems of people in poor countries, low and middle income countries, and marginalized populations in rich countries. And then finally, with regard to the range of disciplines, global health is truly multidisciplinary. So a good example is I am a physician. I practice as an economist, as a health economist, but I have colleagues from all kinds of fields, mathematicians, even engineers that I collaborate with to perform studies. Public health is also multidisciplinary, especially between health sciences and social sciences. But international health has not emphasized multidisciplinary collaboration. So if you read this table, you can get a flavor of what global health means, but there's no consensus out there. But I encourage you to read this paper that I talked about and assigned as a reading for this week. So in this slide, I want to quickly read the definition of global health as written in that paper by Copeland et al. That I talked about in the previous slide. Global health is an area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. It emphasizes transnational health issues, determinants, and solutions. It involves many disciplines, So the multidisciplinary component comes out within and beyond the health sciences, and it promotes collaboration. And it's a synthesis of both population-based prevention and clinical care. So I hope this gives you a flavor of the field of global health. So let's move on to the healthcare system, because healthcare systems are the setting in which we perform economic evaluations. The role of economic evaluation is to support efficiency in health systems. So usually you have a question to answer with an economic evaluation study, and it is to support the healthcare system. So let's look at what the healthcare system is, and it is the combination of resources, organization, financing, and management that culminates in the delivery of health services to the population. Another way to look at it is all activities whose primary purpose is to promote, restore, and maintain health. And the objectives of the health system in the abstract is to increase life expectancy and to improve quality of life. However, there is a third dimension which is very important in our field, especially in this era of the global policymakers who are speaking about universal health coverage, and that is to prevent financial risk. So financial risk protection is the third dimension of healthcare provision. It's the third objective of the healthcare system. Essentially, financial risk comes about because if you get a bad illness, two things happen. One is that you can't work, so you lose income. And the second thing is that treatment itself can be quite expensive. So when people in poor countries or even in rich countries who aren't covered with health insurance get sick, they can essentially get bankrupt, or they have to sell assets or even borrow money. And financial risk essentially can be mitigated by disease prevention and by using system appropriate financial architecture, which is the realm of healthcare financing. And if you look at the WHO health system framework, it divides the system into 6 building blocks: service delivery, the workforce, information, products, vaccines and technologies, financing, leadership and governance. And then the goals are on the right side. We talked about them: improving health, life expectancy and quality of life, but it has this dimension of responsiveness that's added, and then it has financial risk, which we talked about. And we as health economists really operate at this level, which is to achieve efficiencies in the provision of healthcare. And as you'll see in the middle, you have access, coverage, quality, and safety. And for those of you who are interested in doing economic evaluations of policy questions, you will find that many times these 4 aspects in the middle are the main parameters that drive your analysis, because interventions will increase access or coverage, or there will be interventions to increase quality or even safety of different medical products and technologies. Healthcare interventions can be divided into mainstream interventions here and what we call instruments of policy. And interventions are actions taken by or for individuals to reduce the risk, duration, or severity of an adverse health condition. And you can do them at the personal level and at the population-based level. An example is smoking cessation. And an instrument of policy is designed to encourage, discourage, or undertake an intervention. And usually it is the realm of government. So for example, a government might tax tobacco products, and this would encourage people not to smoke or discourage people from smoking, or would serve the purpose of undertaking the process of reducing the proportion of people in the community that smoke cigarettes. And you can perform economic evaluations to assess the value of these different kinds of interventions. So let's look briefly at the different kinds of personal interventions. The first one is primary prevention, which means reducing risk factors of disease and therefore reducing incidence of disease. So if you stop smoking, you reduce the incidence of lung cancer. Essentially, it's the risk of an individual getting this disease. And you have cure, which means someone is already sick, and the intervention is designed to restore their former status. So for example, you might diagnose lung cancer early, and the intervention would be to do a wedge resection to remove the tumor when it's still small, and the person would be cured. Then you have acute management, the third one, which is to decrease the severity of acute events. You have secondary prevention or chronic care, which decreases the severity and frequency of recurrent events of chronic or episodic diseases. And you have rehabilitation, which means that you try to restore function, or at least restore function partially. And then finally, you have palliation, which is designed to reduce pain and suffering from an incurable condition, or one for which rehabilitation is not available. Let's look now at population-based primary prevention. There are three main kinds. The first one is, instituting personal behavior change. The second one is controlling environmental hazards. And the third one is mass use of technologies. So for example, using mass chemoprophylaxis for malaria, for example, to reduce the parasite load in a community. And then let's look at instruments of policy. You have information, education, and communication right here. You have taxes and subsidies. You have regulation and legislation. Then you have the spending power of governments using direct expenditure. And then you have the money they spend on research and development. So these are the instruments of policy. And you'll see that in the middle column there are the goals, and in the right column there are some examples of those different instruments of policy. The other way to look at health interventions is what we call 3 Ps. And these 3 Ps are packages, platforms, and policies. So we already looked at policies. The policy part really is the same as what we called instruments of policy in the previous slides. But policymakers don't choose interventions one by one. A good example is the expanded program on immunization. So you don't just target one disease. You target measles, you target diphtheria and pertussis. So you have multiple antigens targeting multiple diseases, but they are packaged in essentially a package of interventions. So the EPI, the expanded program on immunization, is a package. And platforms mean that you have a certain set of infrastructure that is used for multiple purposes. A good example of a platform is a surgical suite. So for example, if you have a health center 4, or if you have, let's say, a county hospital and it has a theater, that theater can do cesarean sections, it can do surgery for motor vehicle accidents, it can do surgery for incomplete abortions, and you can look at that as a platform. Essentially, the doctor or the surgeon, the anesthetist, the theater equipment. And if you want to do an economic evaluation, you can do an economic evaluation of the entire surgical platform. So that's the other way of looking at healthcare interventions, as platforms or as packages of interventions. So finally, let's look at healthcare interventions as technologies, and this field is called health technology assessment. And you can have different kinds of healthcare technologies like drugs, maybe cisplatin, which is a drug for a chemotherapeutic drug for lung cancer, or biologics, or like elotonib, which is a drug for a biologic for non-small cell lung cancer. Then you can have vaccines and devices. Maybe you have a catheter for fluid drainage, or you have a knee replacement device, or you have a nail, an intramedullary nail for repairing a fractured femur. Then you have diagnostics like CT scans and MRIs and X-rays and endobrachial ultrasound. Then you have procedures like psychotherapy or radiotherapy or proton therapy. Then you have different surgical procedures like cryosurgery. And then you have support systems, which include things like telemedicine, which is very popular these days, and things like electronic medical records. And then, importantly, you have health system innovations. And in my view, although not everyone agrees with me, these are really important in low and middle income countries. The idea that you can actually go into clinics without bringing a lot of new stuff and change the way that clinics are organized and the way that things are done at the clinic, and actually find that you achieve a substantial amount of efficiencies. So you have like changing clinical pathways or healthcare configurations, and sometimes you can do an economic evaluation of this kind of health technology or clinical intervention. And some people also consider HTA to be a technology in of itself, because its purpose is to improve the healthcare system. So with this, I'd like to end this part of our lectures for week 1. In the second part, we're going to look at the definition of economic evaluation and also set out a framework for performing economic evaluations. So see you in part 2.